Hey guys, I want to share with you an interesting case that just came across my desk. This is I only have this image, a case that was submitted from one of our local oral surgeon in town. And you're looking at, obviously axial image, a reconstructed panoramic view of the scan, and multiple cross-sectional images through the area of interest. And here we have 3D rendering. This image obviously looks different from the ones that you're accustomed to seeing in my video because this was taken with a different machine, and the viewing software was also different. Anyway, you can see this lesion, right? You can see an area, relatively circular, well-defined radiolucency, with a diameter measuring about 9.4 millimeter. Looking at the axial view, you can see that it's pretty uh, symmetrical in buccolingual and mesiodistal distance, at least this in this cross axial view, excuse me. But what I want you to see is this thinning of the buccal cortex and expansion of the ridge, right? Another thing that I can't quite tell since I don't have the scan, I would be interested in seeing whether this has now displaced buccally or lingually. At least from this view, I don't think there's any evidence of gross resorption because the overall root length and the root morphology looks very similar to tooth number 19. Excuse me, number 20. Moving downward here, we're seeing cross-sectional images. Again, it is showing that it occupies the entire buccolingual width, causing thinning of the buccal cortex and expansion of the buccal cortex. It's demarcated, I want to say, but it's not well corticated. So I can follow the border, but I don't see a highly corticated outline, especially along the inferior and superior aspect. And lamina dura is, I only have these two cross-sectional images to evaluate, but it's unclear. I don't see definitive outlines of the lamina dura. Anyway, when you look at this, what would you say? This has that kind of mixed density appearance, but unusually, instead of seeing multiple granular opacities, we see these fine little specks of opacities that are present throughout this area, with that kind of very homogeneous appearance, right? So I really don't have much information. I don't know the patient age. I don't know whether the patient is symptomatic or not. But looking at this, I don't think there's any major occlusal restoration. If any, this might be just artifact coming from this distal restoration. So no major occlusal or coronal restoration. So I'm going to presume that this patient is going to be asymptomatic. So asymptomatic vital tooth with this area. So if you're in my D2 class, recently we discussed fibroosseous lesions, right? Fibroosseous lesions. And if you consider one of the fibroosseous lesions, I think it's definitely acceptable differential diagnosis. But for periapical osseous dysplasia, one feature that this doesn't fit very well is that it doesn't have that radiolucent rim, right? Doesn't have that radiolucent rim. So now my pathologist came and showed me this because she's a little confused as well, because under the microscope all she sees is just normal bone. So now that changes our radiographic diagnosis substantially, right? So what I'm thinking at this point is probably a healing simple bone cyst. So let me make my cases for this being simple bone cyst. What it doesn't fit well is this expansion. Typically, simple bone cyst doesn't cause expansion, and it's difficult to evaluate scalloping features, but I do like the fact that it's not well corticated, and the fact that simple bone cysts, they do heal from time to time spontaneously. So there are just too much missing information. I would like to have seen, panoramic radiograph or PA of this, a year ago or 2 years ago, and see if that was still present. If it was more loosened back then and gradually filling with radiopacity, that's evidence that the patient is healing. And this, to me, looks like a kind of a woven bone. The immature bones that are just calcifying. So that's probably what it is, given also the fact that the pathologist sees only a normal bone under the microscope. So I think we're looking at simple bone cysts when you combine, histologic present data findings, and obviously some assumed clinical features. That's what I think it is. But I thought I wanted to share with you just because of kind of interesting radiographic features and the fact that this does not look any of the common lesions that we typically see. So I wanted to just share that with you, and I hope you find this case interesting, and I'll see you in the next video. Bye.